Styes are both very common and very annoying. Luckily, there are some great at-home remedies you can try before going in to see your doctor that help the healing process along quite nicely. And you can even use these products in conjunction with your doctor's treatment to help the healing along. In today's video, I'll tell you about the at-home system from I Love. Welcome back to iSchool with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so that you can have healthy, beautiful, comfortable eyes. Give a little love tap on that subscribe button down below to stay up to date with all the latest eye tips and tricks I have for you. Before we get started, this video today was sponsored by I Love, the company of Drs. Travis and Jenna Zigler. They're both optometrists with a passion for dry eye. They even created an online community called the Dry Eye Syndrome Support Group on Facebook, which I know many of my followers are also a part of. If you are interested in learning more about dry eye and being a part of a great community where both dry eye sufferers and doctors chime in with info, I'll leave the link in my description box. A stye is the slang term for what is really an infected meibomian gland. When the gland is actively infected, we call it a hordeolum, and when the infection is over and only inflammatory debris remains, it's referred to as a chalazion. The treatment I'm going over today will be more effective for active styes or hordeolums, but can safely be used on both types of styes. So what is a stye? It's an infection within the meibomian gland of your eyelid. You actually have lots of these little glands lining your top and bottom eyelids. Their job is to secrete the oil that makes up the top layer of your tears, but they can become laden with bacteria and infected. And this can happen from environmental exposure, dust and debris, or even your makeup or rubbing your eyes. They can also happen seemingly for no reason at all. There are basically three things happening with a stye: inflammation, infection, and obstruction. The infection is causing inflammation, and the gland is filling with both infectious material and inflammatory mediators, causing physical obstruction of the gland. That's why you see a bump on your eyelid. So when treating a stye, we want to address these three physiological things that are happening. We have to address the inflammation, the infection, and the obstruction. So the inflamed tissue or the inflammation needs soothing support. I recommend cleansing the area with an eyelid and eyelash safe product. One of my favorite products to achieve this is hypochlorous acid spray, and I'll link a video where I talked about that above. You may have heard of hypochlorous acid in the past 2 years because of its usefulness in cleansing and disinfecting in regards to the coronavirus. But hypochlorous acid is an eye-safe spray that has been formulated to be used around the eyes to reduce bacterial load and provide relief for itchy, tired, red eyes, and even for styes. Cleansing with that Heyedrate lid and lash cleanser is a great first step to getting rid of your stye. You'll want to use the spray twice daily, morning and night. Apply it to a cotton ball and apply it to the lashes. Make sure to get to the base of the lashes. There's no need to rinse this off. You can just let that solution dry. Our first step of hypochlorous spray begins the process of addressing the infection happening within the gland by reducing bacteria on the skin's surface. Next, we want to further cleanse and reduce bacteria by using a wipe. And I like this MediViz eyelid wipe for cleansing away unwanted dead skin cells and bacteria. You're going to gently cleanse the area over and around that stye at least twice a day while that stye is active. With an active stye, this is slightly different in process than with your typical dry eye routine, which you can also use these wipes for a typical dry eye routine. I would likely spread out the use of the hypochlorous spray and the wipes so that there's about 3 hours in between your treatments, and you're kind of alternating the spray and the wipes. Finally, because the gland is obstructed, we want to encourage that oil to release and come out. One way to influence that process is to apply heat to the glands. With a stye, heat can be very effective. You want to introduce heat to the stye early and often as you can stand for as long as you can stand, will greatly increase the chance of the oil coming out of the gland. Heyedrate's White Heap and Cleanse system can be used for dry eyes and blepharitis as part of your daily routine, but it also makes a great complement to your doctor's therapy for your stye as well. Speaking of your doctor's therapy for a stye, it is always a good idea to check in with your eye care provider when you have a stye. These at-home therapies may work for smaller styes or get you through until your doctor has an opening. However, in my clinical experience, patients do much better when we can get an antibiotic or steroid prescribed quickly. Utilize my tips from this video to get started on that stye and then hopefully prevent it from getting worse before you get in to see your eye specialist. And if you have made it this far and you're not already subscribed to my channel, please hit that button and the bell so that you don't miss notifications. That's it for today's iSchool. Class is dismissed.